again, most of the veins here have the very same name as the artery, which makes it a lot easier because then there's not extra names that you have to learn. Probably should have drawn like hemiazygous and stuff on there. Okay, so what's the big one?
Superior vena cava.
This is veins. So this is superior vena cava. And the big one going down through the
Inferior vena
abdomen
cava.
is inferior vena cava. Yeah, there's some stuff I need to add to this drawing. Okay. Do you remember what the two branches that feed superior vena cava are?
Brachiocephalic.
They're brachiocephalic veins. So here, here. Right. So the two brachiocephalic veins come together to form superior vena cava. Coming from, so the neck is up here. So coming from the neck, we have an internal and an external jugular vein. And I think except for on the boyfriend, we're just gonna call them jugular veins, because on the cat you can only really see a jugular vein because their neck gets like shredded and the defurring and stuff. And then the cadaver, I don't think it's dissected out enough for you to see where jugular actually is an internal and an external. So for the most part, if you just call it a jugular vein, then I'm pretty cool with it. And then coming from the arms, this one, oh yeah, this is subclavian vein. So we have a subclavian vein once again. So this right here is the subclavian vein. Then we get clavicle, and once we've gone past the clavicle, that was axillary vein. And then once again we have an anterior and a posterior humeral circumflex. And before that we had a brachial vein. And then blood coming back from the thumb travels through radial vein. Blood coming back from the pinky goes through ulnar vein. So if we're coming back, right, because blood in the veins is going to the heart. If we're coming back from the thumb, it's radial vein, brachial vein, axillary vein, subclavian vein, brachiocephalic vein, superior vena cava, and then the heart. So an important thing, a really important thing, and I think somebody on the practical asked me, like, wait, we didn't learn what was, I pinned brachiocephalic veins and said, where will blood go to next? And they asked me, they're like, wait, we didn't learn anything past brachiocephalic veins, and they meant out in the arms. And so I asked, what direction is blood flowing in veins? And in veins, it's going to the heart. So then they knew, brachiocephalic veins go to superior vena cava. So this is where remembering the direction of blood flow is going to be really important for remembering where blood goes to next, where blood will just come from. So remember, in arteries, blood is flowing away from the heart out someplace. In veins, it's coming from someplace to the heart. So remember this. And I'll try and like ask questions as we go along looking at cats and stuff. I hope I can get to my cat. He's measuring formaldehyde levels or something, I don't know. So it'll be done. But, okay, let's see. And then out in the legs, we make it pretty simple too. Once again, inferior vena cava goes down here. And then we get a common iliac vein. I didn't leave very much space here. This one is internal iliac vein. And out here we have external iliac vein. And then we have inguinal canal, and then this guy is greater saphenous vein. Greater saphenous is the most superficial one. It's very superficial. You can, like on that cadaver, you can see it. It's running all along here. It's just like this one big continuous vein that you can just pull and like look at. Greater saphenous vein. We have the medial and lateral femoral circumflex. So we have the femoral vein. And then behind the knee we have popliteal. And then down by the tibia we have an anterior and a posterior tibial. Veins are simpler. There is some stuff that I need to add to this drawing. I don't know if I'll actually add it to the drawing. I might just show it to you guys on cadavers and or on models and stuff instead. Because you are also responsible for gonadal veins, renal and suprarenal veins. Maybe I should just draw them. Well, none of you guys are. Who's even? No, there's people drawing. Okay. Where did the black just go? Did it fall?
It's right there in the glass.
And then gonadal. Okay. Alright, so here's where it gets a little bit weird. So we have the renal vein draining the kidney, and the suprarenal vein draining the adrenal gland. Okay. And then here on the aorta, the arteries that are supplying the gonads, so gonadal, that's just general term. It's if it's in females, it's the ovarian artery. If it's in males, it's the testicular artery. So just in general, we have gonadal. These guys, in the arteries, they just both come right off of the aorta and then go down to the gonads. But in the veins, okay, on the left side, the gonadal vein actually drains into the renal vein, but on the right side it goes straight to inferior vena cava. So it's different depending on what side of the body you're on. And that's similar for those intercostal veins. Remember, if you're an intercostal vein on the right side of the body, you go to the azygous vein and then to superior vena cava. But if you're an intercostal vein on the left side, you go to hemiazygous to the azygous to superior vena cava. Okay. So on the left side, the gonadal has to do an extra step also. Okay. So on right side, it just gonadal vein, inferior vena cava to the heart. But on the left side, it goes gonadal vein, renal vein, inferior vena cava to the heart. Okay, so that's important because I like to ask that tracing if I can, or it's one that if Noriega gives me that question, I won't change it. Any questions on this?